Happy Monday. Welcome to Motivational Monday on a Memorial Day. Hang on. I'm coming to you live from my studio shed where it's a torrential downpour outside. Of course, the second I have to come running out here. So if you hear some thundering and raining, yes, it's on my end. I hope everybody had a great long weekend, or if you're still in the process of enjoying yours, thank you for joining me today. I'm just going to double, and there I am up and running on the other end. If you are joining me today, it is Memorial Day in the US and it is Victoria Day here in Canada. So welcome, and I hope everyone. I see there's a couple of you there. If you're joining me today, today is about Lupus Awareness Month, and I've got my top three. It's actually two with a twist for the third on some self-care tips if you are managing the symptoms of lupus. Perhaps you suspect you have lupus, but do not necessarily have a definitive diagnosis. But it really depends on where you're at in your situation. One of the big things with lupus is how long it does take people to actually get a diagnosis. It's one of the things many conditions I guess struggle with when there's symptoms in common. Very often lupus goes undiagnosed for periods of time. So what is lupus? I think most people have probably heard of it. I wouldn't say it's uncommon. All of the references I am citing today are from the US association called lupus.org. I'm going to just drop a little plug in there and start the awareness. If you are dealing with lupus or managing the symptoms of, please let us know that you are here, how you're managing it. Lupus is a chronic disease, long-term, that can cause inflammation, pain in any part of the body. It's an autoimmune disease or disorder, and which means your immune system, the body that usually fights off infection, illnesses, attacks healthy tissue instead. So there's four basic types of lupus. There's systemic, which is the most common form of lupus. And there's also cutaneous lupus, which is a form of lupus that is more, presents on the skin surface, and this is where a lot of misdiagnosis, maybe it's misdiagnosed as psoriasis or eczema, but that one presents primarily on the skin. There is drug-induced lupus, which is mimics the symptoms of the disease, but it's caused by certain use of certain prescription drugs. And then neonatal lupus is a very rare condition. It affects infants and women who have lupus. There's about 1.5 million folks in the United States living with lupus, and about 16,000 new cases every year. More than 5 million people worldwide are living with some form of this disease. Interesting, 90% of people with lupus are women. Most people with lupus develop the disease between the ages of 15 to 44. Again, these stats are coming from lupus.org, which I've dropped in the comments. So what are the symptoms and why are we here today? Yes, it's Memorial Day. There are some things I will mention towards the end of the live, but with lupus, like many of the conditions I talk about, it's about symptoms. And unfortunately, if you do not have a diagnosis, it can be frustrating, trying to identify what your body is going through, but it's going through something. So I always talk about you don't necessarily need a diagnosis to start taking advantage of some self-care. And if you're joining me here through the VIP group or LifePro's main page, chances are you may have some of their gear and some of it may suit purpose to manage some of these symptoms. So that's what I want to talk about today. So some of these symptoms are the big one, obviously being pain, extreme fatigue, hair loss is a common one, cognitive issues, physical impairments or limitations, if you will, and it can affect every avenue of your life, your independence. Many also suffer with cardiovascular disease, strokes, disfiguring rashes, joint pain, inflammation, and for others, no real visible symptoms present. So sometimes it's one of those diseases where just because something's not visibly obvious on the outside doesn't mean that there's not an internal struggle going on within your body. And there's many challenges to reaching a diagnosis, as I mentioned. It's one I was reading on the site, and it said it's one of the great imitators, lupus, because its symptoms in many ways mimic other illnesses. So lupus symptoms here to begin with, they come, they go. You have good days, you have bad days, and symptoms can change over time. So today, what we're going to talk about for lupus symptoms, and again, a lot of them are similar to other conditions. It's not uncommon if you are dealing with lupus or suspect that you're dealing with lupus that you have other conditions, and in particular, other autoimmune conditions. So a lot of the things that you are doing now to help manage your autoimmune disorder, or are supposed to be doing now, are going to do dual purpose if it is in fact lupus that you're dealing with. So pay attention to your body and listen to those symptoms. By large, it is recommended if you are dealing with lupus or any autoimmune issue, we know exercise is good. It builds strong bones. It makes our muscles stronger. It helps us keep independent, gets lymph moving. There's never not a reason to exercise. What always becomes challenging with medical conditions or deteriorated health is what activities, and if you're not an exercise guru now, sometimes exercise seems like work. We call it a workout. What I would like you to start thinking about is being active to not only improve your overall health, but to help mitigate and manage the symptoms. And one of the tips I'm going to get to today is how you can combine some of these tools to reduce the time that you spend doing the self-care and just start having more you time. So it's highly recommended that you look at a gentle, low impact form of activity. It's easier on the joints and the bones. And very often, if you are dealing with lupus and it's pain and swelling and limited mobility type of symptoms, it's hard to sometimes even go for walks or do a treadmill or forget the gym. So again, of course, I'm going to bring you down. We're going to start with vibration today. Vibration can be an activity, but by large, there's so many therapeutic benefits if you're dealing with a lot of these symptoms. Someone asked me, interesting, on last week's session, why don't you ever wear shoes? Why are you always kicking your shoes off? I prefer no shoes. We weren't born with shoes. And if there's a reason medically that you should be, you've got open diabetic sores, or you've got some brand new orthotics your doc wants you wearing, absolutely there's reasons to wear shoes. But I prefer not. I like to keep the muscles in my feet, my ankles strong. And I kind of live in bare feet all the time anyways. So shoes or no shoes is absolutely a choice. Sometimes it's a combination. There's never black and white, just like some of the treatment we're going to get to now. So when you're dealing, as I said, with lupus, like any medical condition, I'm going to bring this down a little bit more. It's not about the condition. It's about you personally and where you are physically able to start and where you want to go. Just because you have lupus doesn't mean that you don't have goals in life. Maybe you want to get stronger. Maybe you want to tone your muscles. Maybe you want to gain some weight. Maybe you want to lose some weight. So one of the reasons that a vibration plate is such a fabulous tool when you're dealing with not just only lupus, but chronic symptoms is it's kinder on the body than traditional activities. What type of activity you choose to do on the plate is driven very much by your ability and those symptoms that you're managing. So today I'm starting in a chair, which is not an uncommon place for me to start. If you have a vibration plate now, if it's something that you've been considering as part of your self-care for lupus, and fear is there, or excessive pain, perhaps you have poor balance or mobility issues, perhaps you suffer from fatigue. There's a number of reasons to start seated. The main thing that you're doing when you start in a seated position is you're reducing the amount of body weight that you're exposing the rest of your body to. And it kind of gives you, if fear is the reason that you're not using this or haven't considered it, it gives you a chance to see how it feels without completely committing to a standing position. If you have issues standing on the floor for long periods of time, this can be intimidating. So I always recommend starting an oscillating movement. Oscillating is teeter-totter, pivotal. There's a number of names for the movement. It mimics how you walk, but with much less impact. Why does Debbie recommend oscillating? You'll get more functional training gains. And one of the big things when you're dealing with deteriorated health, very commonly, is poor balance and stability. So just the nature of your body always trying to stabilize itself without even realizing while you're on this plate, balance and stability is the very first thing that will improve regardless of how long you're using it. It's consistent, regular use. If you're dealing with a lot of pain, two things that you always control, I'll recap quickly, is the speed, how fast you are going, changes the intensity, the feel of the vibration. Instinctively, we want to start slow. No, not in oscillating. Debbie's going to speak opposites here. To reduce impact completely, bring your feet dead to the center. Intensity is driven by your amplitude in this type of movement, and that's the position of your feet. If you're dealing with chronic issues, you're just getting back into this, you're recovering, I want you to bring your speed range up to a mid-level, but bring your feet closer to the center. What you'll find with your speed ranges, I always speak ranges, there's never an exact number or feature for any one condition, but it's about, I want you to understand how to play with this device for your own tolerance. As I said with lupus, it's one of those conditions where you have good days and you have bad days. And I want you to be able to understand how to use this tool effectively depending on how you're feeling. So if you start every session with your feet dead center, bring it up to a mid-speed range. So if you've got 60 speeds, be in the 30 to 40 range and change the speed every week. Keep the body confused. It's a subtle way of keeping the changes progressing without you having to learn a whole bunch of new moves every time. So if you're dealing with lower leg pain, you just want to get warmed up before you do other things. You're going to be doing a lot of walking. You're just getting used to your plate. Seated is a good way to start. For those of you that are able to stand, I want you to. The more that you can bear your body weight, and even just standing on the floor in your kitchen, is going to prolong and improve your bone density. It's going to make you stronger. It's going to make you more stable. Short term when you start exercising or becoming active again, if you're dealing with pain and fatigue, it's very common to be fatigued very quickly. So the beauty of a vibration machine is you can get a lot more movement and muscle activity in less time. So instead of pushing yourself to a point of exhaustion, what it's actually going to give you is a boost in energy, a boost in balance, a boost in circulation and lymphatic movement. And all of these things go a long way in treating things like achy joints, poor balance, restless leg, whatever the symptom is that's presenting to you. In a standing position, I want your feet no more than hip width apart. Our knees are always slightly undone to absorb the movement. If you want to experiment and lock your legs up, it's not harmful, but you'll feel it all goes to the head. And if you stand really wide, it makes it even much more aggressive. So feet are close, no more than hip width apart. Excuse me just for 2 seconds. Yeah. What do you need? Okay. All right, sorry. It's raining. My hubby just came to get my puppy dog. Okay, and if you're just starting out 2 to 3 times a day, ideally for a minute or two, just to start building energy, just to keep things loose and limber and start giving you better quality day, keeping you independent. If you want more benefit, things like weight loss, muscle toning, muscle strength, you want to be able to get up out of the chair and down those stairs easier. You can gain benefit from standing, but long term, the more that you can move within your range of motion, push yourself into more fitness-oriented positions, the more fitness benefits you're going to achieve. So just by taking that standing position and bending slightly, you'll feel the vibration kind of leaves the upper body and torso, and it's now hips and below. And you'll feel that the muscles in the quads, the calves are firing. You want to keep the majority of the weight on your heels. You never want your knees to pass your toes. If you notice that perhaps you're going lower than your range of motion, perhaps your body's trying to cheat, it always tries to find an easier way. And if you've got a weak side, a strong side, it's not uncommon when you start pushing yourself, your body may shift over to that strong side and try to compensate for weak spots. So, try to consciously, if you do have a weak side, try giving it a little extra attention, shifting over to let's say the left side is weak. And you don't need to move up and down when you're first getting started, just holding good posture, making sure you're breathing. Again, I want you getting comfortable experimenting with all these little subtleties when you're on the plate before you get into a big elaborate routine that, quite frankly, may be too much for you if you are dealing with lupus. And progress and build towards something like that. Start with some good solid foundation. The other really cool thing about vibration plates, if range of motion allows, if you haven't figured out by now, obviously activity and getting moving is my first tip. My first top tool for managing symptoms of lupus, of course, is a vibration plate. And it's always a little bit more of a discussion with the vibration plate because it can be a therapeutic tool, it can be an exercise tool, or it can be a combination. It really depends on you, your consistency, and what you're doing physically for positions while you're on the plate. The plate is just an environment that makes those exercises more effective in less time, with less impact, and a little less effort on your part. My next tip that I wanted to get into was massage. So one of the really great ways to manage the symptoms of lupus is massage. I don't know if you see a massage therapist now or if it's something that you've been looking at. With lupus, it's one of those things you've got to be careful. You might be prone to bruising. You might be tender to the touch. So some of the tools at Life Pro that are so effective for managing the symptoms are simply because you can sort of gauge your own tolerance. The first tool I was talking about was a vibration plate, but I'm going to bring another example into the equation. So there is a form of being massaged whenever you're on the plate. So the reason a lot of people feel energized and happy and their pain reduces is it's just the nature of the technology. A vibration plate can give you a massage effect. It's as I said, when you're putting an effort that you'll get more of the fitness gains. A massage gun is going to be just as effective as a vibration machine, but it's different in its purpose and application. So if range of motion does not allow you to get down on the ground and apply upper body to the machine, a really cool variation, as I said with lupus, sometimes it's a head to toe thing. Its symptoms can present anywhere throughout the body. So if range of motion doesn't allow, a really cool way for tip number 3, which I'm going to kind of combine the last 2 tips. The best way to manage your symptoms is to combine tools to reduce time, increase effectiveness. If you're managing this and living on your own, anything that you can do to increase the effectiveness of your therapies is just going to equate to a better quality of life and continue your independence for as long as possible. So what you can do while you're seated on your plate is perhaps, maybe let's just use the knees as an example. So my feet are on the plate, getting some basic, lower body stimulation. And what I'm going to do is I'm going to use the massage gun, same lesson that I gave you on the vibration plate. I want you to turn it up to a mid-speed range and let the gun do the work. As I said, you don't want to apply a lot of pressure. Some of the folks dealing with lupus and these types of conditions are dealing with bruising. You tend to bruise easily. If lymphatic stimulation is your goal, just skimming, the lymph vessels are just below the skin surface, so you don't need to apply a lot of pressure. My hubby likes doing this. He gets restless leg, more so on the left side than the other. So a lot of times he'll use this while he's seated on the machine on the stool, just to target the legs a little bit more specifically. If range of motion allows, you can use your massage gun anywhere. It doesn't mean that you necessarily even have a vibration plate. But this is a really simple way to help target symptoms throughout the course of the day, keep them at bay so that by the end of your day, things haven't built to the point where you don't have an evening because you're done for the day. For those of you that are able to get down on the ground and have a bit more range of motion, I'll get back to this in a minute. Let me just put this down a little bit. You can massage directly on the machine. So this is just an example of massaging your calves. So what I've done, I'm sitting on the floor. You could lay down. You could sit yourself up on the arrow step or something if you wanted a little bit of support. When you're massaging, again, in oscillating movement, get up to the mid-ranges for sure, maybe even a little bit higher. You'll find when you're massaging, you can tolerate a higher speed than perhaps when you're standing or doing push-ups or something of that nature. So this is a really great way to use your machine. If you have the range of motion, it's never the getting down, it's always the getting up. And how long should you massage? 1 to 2 minutes per body part is really all that you need. It's easy to go longer, 5-10 minutes when it feels so good doesn't take long to pass by. But what I will caution, if you're just starting out, it's easy to overdo the massage, and it's easy to overdo the machine in general. It's very common. We just set it for the preset time, and it happens all the time through my sessions. I've already talked 15 minutes, and I've only done about 3 exercises. So I do caution you until you get using your machine more regularly to keep your sessions short and more frequent. Learn how to manage your symptoms before you press on, unless you're doing fitness things now, and progress in changing up exercises. Don't just go longer and longer and longer. So that's just one example. Each of us, myself, Roseanne and Amber, have done a number of sessions on the vibration plate. And, maybe you're dealing with a back issue. Maybe you're dealing with plantar fasciitis. Just because you have lupus doesn't mean that you're not dealing with other common symptoms that other conditions present. So if you have a new diagnosis, never fear. Life Pro is here with many tools just for your own self-care and therapy. I'm looking for my glasses so I can actually see what I'm looking at here. Oh, they're in my back pocket. What do you know? So tool number 1 was vibration plates. Tool number 2 was massage. And I kind of showed you a couple of ways to combine those. The third very important tip, and I also have a caution with this, is light therapy. But very specifically, I want to recommend one type of light therapy when you're dealing with lupus, which is infrared. Infrared, if you go into Google and you type lupus and infrared scholarly articles or something of that nature, you'll see there's a healthy body of research that already supports infrared. Infrared is a very soothing, it's that warm spectrum that you'll feel with the sun's light. The benefit of infrared for a condition, particularly like lupus, over other light therapies. With lupus, I have to caution you to be very careful with photosensitivity. Photosensitivity is when you are more prone to sunburning, or you're more sensitive to light, natural or artificial light therapies. So be certain that you discuss with your doctor first if you're looking at administering light therapies for your lupus. Sometimes it can be something that they absolutely recommend, but depending on what medications or other treatments you may be doing, you may be more photosensitive. So infrared is great at going deeper below the skin surface, those aches, that joint inflammation, just a really, really ideal tool for lupus and autoimmune in general. But with lupus in particular, you want to be careful with those skin surface treatments. And just make sure that if the photosensitivity is there, it doesn't mean that you can't use the product, but you want to make sure you check with your doctor, see if there is sensitivities, and you may need to modify your times or how often you're using it, just knowing what your personal situation is. So that's just my recommendation. For those of you that are joining, it is a Memorial Monday, so I'm hoping many of you are out playing and doing other things, but I do want to thank you for joining me for a little bit of awareness today. Again, if you are dealing with lupus and you're not having the best of luck managing your symptoms, or you suspect that you may have, some of the therapies you probably have now with Life Pro are going to be great tools. Again, get active. A vibration plate makes that so much kinder on the body for any condition. Massage is there's a ton of massage options with Life Pro, whether it's wearables or massage guns, things like that. And then infrared light therapy is my last recommendation. I will also end the segment by saying Life Pro's having a sale. It's Memorial Day, so I think there's 15 to 20% off on site. I'll drop a link for that later on today. So if you've been thinking about something, it's Mother's Day and last weekend, and you were looking for something else for yourself and you never got to it, there's some good specials on this weekend, perhaps for your grad or whatever you might be dealing with. So thank you for joining me today. If you do have lupus and you're watching this after the fact and you have questions specifically for me, please tag me in any of my sessions at Debby with a Y, and I'll be happy to answer those for you. Have a great rest of your week, and I will see you guys next Monday, same time, same place, 5 p.m. Eastern Standard Time, 2 p.m. Pacific. Have a great short week ahead. Thanks, guys.